Yeah, I'm gonna stop it right now.
Thank you guys. Thank you guys for all coming in for our first day of Medicine Week. We're really excited. We did this last year and it was a huge success. And we actually have one of our doctors that were here last year too, coming and presenting today. So my name is Sonia and I'm the founder and president of Medical Wonders. I started in March 2020, and later on you'll learn more about what we stand for and why we're kind of doing this for you guys. And I'll give it over to Elena to introduce herself.
Hi everyone, I'm Elena. I'm a member. Well, I was initially a member in Medical Wonders, and now I'm part of the media managing team. And we can get started. So, welcome to the Medical Wonders Medicine Week of 2021. We'll be doing this Medicine Week from August 2nd to August 6th. And today we have Dr. Tina Ho with us. She'll be presenting, but first we'll introduce the organization. So first of all, Medical Wonders is a student-led organization and soon to be nonprofit that helps educate and advise students about medical procedures, careers, discoveries, and devices. We have 4 executive teams, 50 tutors and 10 college overseers, and over 200 members. There's over 300 people involved in our organization. We've reached other nonprofits and have over 4.3 thousand followers. So what is the Medicine Week? Every day this week, a medical professional or student will go on Zoom with us for an hour presentation that will have their introduction, some studies, and a Q&A session at the end. You can check out our Instagram for more information about each doctor or student. It's at medical.wonders. So for this Medicine Week, you can get hours, and to get the hours, you have to attend 2 or more calls, and you'll get 2 hours per call. We'll be marking down attendance in Zoom, but you have to get your hours through the Google Classroom, and we will be recording this meeting. So if you are bothered by the recording, you can just turn off your camera. And if you have any questions, write down questions in your chat. Also, you have to submit a 5 to 6 sentence paragraph on the Google Classroom, and make sure you write down your name for each paragraph, and you submit each one under the right call. Once you submit it, you'll get your certification with your hours and your full name. Just be patient because this may take a few weeks or days. And you can also list this Medicine Week on your resume. Also, this is our YouTube channel where we'll be posting the recordings of the Zoom, and there are other recordings there, so you can subscribe as well. And if you have any questions, you may unmute yourself or write them down in the chat.
Yeah, just to clarify, I have to just redo that. The only thing is, instead of 14 hours, we're doing 10 this year because we have less professionals, and it just planned out that way. So just keep that in mind. I also put that up in the Google Classroom if you guys are joined, and you guys need to be joined anyways. So just email us if you don't have any, access to the Google Classroom or anything like that. But now we can just give it to Dr. Ho. So you can take over.
Great. Thanks so much for having me again. Again, I'm Tina Ho. I'm a facial plastic surgeon in Philadelphia. Feel free to follow me on Instagram, DrTinaho, Dr. Tina Ho. I can put that later in the chat. Really appreciate the support with following, especially if you want to see more of what I do, day to day, and also more kind of my personal life too, as a facial plastic surgeon, as well as the work I do, like the types of procedures and before and afters. So I'd like to take the opportunity, hopefully for the next 20 to 30 minutes to talk more about my practice and show a before and after case, just to kind of get your, help with your learning, not just talking about my profession, and then leave the rest of the time for some Q&A. I think that's always the best part, to have interaction and hear from all of you what you want to know more about me and my scope of medicine. So I'm someone who's originally from the East Coast, grew up suburbs of Philly, and eventually moved to DC suburbs of Virginia, which is where my family is still at. I ended up going to William Mary, College of William Mary for undergrad. I majored in neuroscience as well as international relations. Before college, I always had an interest in medicine, particularly plastic surgery for my own childhood surgeries. I grew up with I was born with a large nevus, think of like a large mole right here, that needed to be removed early on since it could have been potentially cancerous later. So that involved a number of reconstructive surgeries. My surgeon is still at Children's Hospital of Philadelphia. And with those experiences, I saw early on the positive immediate impact that my surgeon had on me, and I wanted to be in a similar role for other patients. And so, I was lucky enough to be able to excel in science and math in college. Did a first major of neuroscience, and had some room in my schedule, so I majored in international relations as well. I strongly recommend to all of you that medicine, definitely make sure it's a career path for you, because it's a lot of time, money, personal life, a lot of stress, all of that involved and invested, and it's a long journey. It can be a lonely journey too. So not only you make sure that you want to pursue a career in medicine in general, but also too along the way to take the opportunities, whether it's picking a different major, exploring different extracurricular activities outside of medicine, things that will make you more balanced as a person, and things that you enjoy outside of medicine, because I think ultimately that gives you the opportunity to stay balanced, to seek self-care, and to be the best physician you can be later on. Also too, that involves that if you want to take your time with the process, it's okay. I'm someone who went straight through undergrad, then medical school, then my training. So I always, it's hard for me to see another career path or taking time off, but it's okay to take a gap year if you need to really figure it out, or you just know you want to take that time before you get into the rigors of medical school and eventually residency. Also in undergrad, I had the opportunity to participate in a couple of medical mission trips in Central America, and they're actually primary care focused. But what I got away from those experiences, not only to be able to have a medical experience and be able to directly help patients, but also I think the more important thing was I came back with a more idealism of service, like wanting to give back, which I think is important, and having a perspective of what it really means when it matters so much where you're born, and how that dictates the rest of the opportunities in your future that you have. I think it's important, whether it's a medical mission trip or think about studying abroad. If you have that time and opportunity, the finances to do it, I think that it gives you more that broader perspective to appreciate what you have as an American, and to be able to see what a different culture is. I think that adds an extra dimension, not only as a person, but eventually as a physician as well. After William Mary, I went to University of Virginia for medical school, so I was able to stay in state for all of my education. And going into medical school, again, I had an interest in plastic surgery, was a bit intimidated because I knew it was really competitive. I didn't know anything about ENT, otolaryngology, which is what I ended up doing residency in. So strongly recommend, when you think about medicine, even if you're interested in something surgical, be as open-minded as possible, because you never know, right? You don't know until you're doing the clinical rotations, you're working with those other doctors who are in that field, if this is the right fit for you. medical school, for me, I was fortunate to stay balanced with both school and doing extracurriculars. I realized early on enough I was very average in my class. There was no more getting A's in school. It's a tough adjustment, especially because you're now in a higher tier, a much higher, select tier of individuals who are really good at test taking, who are super smart. Ultimately, third year medical school is where you do your clinical rotations. General surgery was my favorite core rotation, and then I picked surgical subspecialties in both ENT and plastic surgery. And when I say plastic surgery, I mean general plastic surgery. So you learn to do, you have a foundation in general surgery, and then you do plastic surgery after. So with ENT, it actually, I felt like that was more of a fit for a number of reasons. One, I appreciated being more of a specialist, like a head and neck specialist. The anatomy is great, very intricate, meticulous. You have like your cranial nerves, your small blood vessels. ENT was a good balance of operating and clinic. A lot of your patients can be healthy. You don't necessarily have to spend a lot of time in the hospital, so that, leads to having a good work-life balance. I also saw there was a route to facial plastic surgery in case if I wanted to do plastic still. And then two, I felt like I really clicked with the mentors I had there, the attendings and residents, who again seemed very smart but approachable people with balance, a good work-life balance. And then, just to contrast that to plastic surgery, again, I really enjoy that rotation too. I think, you first in your 6 years of training for plastic surgery, you do the first 3 years in general surgery, and then you do plastic. So, that didn't appeal to me as much. Some of the things that plastic surgery covers that I just never had an interest as much, like wound management, you know, I think I would have been fine like doing breast surgery, abdominal surgery, but it just wasn't as much of a calling there compared to anything facial. And also hand surgery is a big component of plastics. And then again, that's just a certain part of the body I just, never had much exposure and interest in. So I ended up applying to ENT for residency, was lucky enough to match in the Midwest University of Kansas. ENT is a 5-year residency. And then just think, like, if you think that sounds like a long amount of time, it's not too bad. The minimum amount of residency length is 3 years. And say if you do medicine or peds and you want to do a fellowship like GI or cardiology, you end up doing at least another 3 years. So for me, my training was 5 years residency, then 1 year fellowship. So that really isn't that much, time, 6 years total relative to other subspecialties. At University of Kansas, was lucky enough to have a great broad clinical exposure to all the subspecialties within ENT. And it just, again, with facial plastic surgery, I just found that it still really clicked for me. It's interesting. I've learned that, the field of medicine you choose, not only that might be the field that most interests you, but it may be the one that just best clicks with you from a personality trait standpoint. So for me as a surgeon, I like to be decisive. I like to work with my hands. On the other hand, I'm impatient. So I want to see immediate results. I want to see something tangible and immediate. I'm also a perfectionist. I'm detail oriented. I don't mind suturing at all. Having the attention to detail, which I think goes well with being a plastic surgeon. So after University of Kansas for 5 years, I then spent a facial plastic and reconstructive fellowship 1 year in Chicago. I wanted to be back on the East Coast, somewhat closer to my family. So I first found a job with a dermatology group in the Philadelphia area. I did between finishing fellowship in June. I didn't start my first job until November. As I mentioned before, I went straight through with my training. So with my now husband, what we decided to do, because this was the only time to take off, between starting my real job, is we traveled to Europe for 5 weeks. And then we got married in October and did a honeymoon for a couple of weeks. So it was just great to be able to prioritize that personal time. I even felt like I could have taken more time off. And especially too, in these times of the pandemic where we're just more hindered now, especially when it comes to travel, even those days where I feel, like I can complain like, oh, I haven't done much in the last year. you know, that in 2018, we had those opportunities to travel, and we feel extra grateful for that opportunity, that time taken off. And so, you know, I first joined a dermatology group. It didn't work out. And then I became an independent contractor, joined, you know, a med spa in the suburbs, and wanted to be back in Center City. And eventually, just this past year, of how my practice has developed, I've hustled, you know, to try to recruit surgical patients. I opened my own practice as of July. So that's a new change, you know, for those of you who came to the session about a year ago. So I have my own office in the suburbs in Wayne, Pennsylvania. And, you know, so I'm a business owner. I mean, I have been as an independent contractor for a couple of years to really have my own space. I still am with a derm group one day a week in Center City. So it's been a great balance to have two offices, and to, you know, to be able to you know, have two different patient populations to help take care of. Now, I'm just going to quickly go over, you know, what facial plastic surgery encompasses, and happy to help answer more questions there. I know probably last time I went into more in depth. So when you think about facial plastic surgery, it's, you think of the cosmetic versus the reconstructive side. Cosmetic side, which is the majority of my practice, so no insurance, cash based only. You have the non-surgical treatments like Botox, filler, laser resurfacing, and just know other specialists can cover this part too, or the surgeries I do. That can include dermatologists, oculoplastic surgeons, or general plastic surgeons. And then for surgery, you know, there's rhinoplasty and septorhinoplasty. Rhinoplasty just improve the outer appearance of the nose. Septorhinoplasty can improve the appearance as well as the breathing function of the nose. As someone who's an ENT specialist first, I know well the function of the nose, and I think I have an advantage when it comes to performing rhinoplasty. And then you also have, you know, procedures, whether it's to help, you know, improve facial contouring, jawline definition. You have buccal fat removal, you have liposuction, and then the surgeries that are designed for the aging patients who want to look younger. Brow lift, upper eyelid surgery, lower eyelid surgery, facelift and neck lift, facial fat transfer, and also laser resurfacing. So those are a lot of the procedures I do under cosmetics. Other procedures under cosmetics that I don't do but can be covered by a facial plastic surgeon, that includes hair transplantation, gender reaffirmation or facial feminization surgery. So those who want, you know, say it's like shaving of the Adam's apple, or wanting more feminine facial features. I'm trying to think what else from cosmetics that I don't cover per se that other surgeons may. Sometimes more like intensive jaw surgery, like I do a chin implant, but putting like other implants or really bringing the jaw out, that can be covered by, you know, another kind of plastic surgeon or an oral surgeon, potentially. And then on the reconstructive side, you have the categories like facial trauma. So if someone has a cut on their face or they break bones in their face, we can help repair that. Someone who requires skin cancer reconstruction, whether it's from Mohs surgery or a bigger skin cancer defect that requires like a free flap reconstruction, like say part of their tongue or their jawbone is missing. Facial paralysis patients, we can do procedures to help restore function and symmetry to their face. And also those surgeries repair congenital conditions like removing like vascular lesions like you know, vascular malformations, hemangiomas, repairing cleft lip, cleft palate. Just know that arena a lot of times has still been historically covered by plastic surgery. So if you want to go that route, like especially craniofacial, it might be easier to go the plastic surgery route. And so, and then now I just want to talk about, you know, just my private practice, more kind of, you know, pluses and minuses of private practice in case of that. You know, it gives an opportunity for any questions or if you want to know more about it. So as someone who's now, or who has been in private practice and now on my own, you know, I had applied for academic jobs too, coming out of fellowship. There just wasn't as many opportunities to apply to or for openings across the country. And so for me, the things that I miss outside of my practice that I, wish I had that sometimes maybe like an academic practice, for instance, could offer. I do miss the teaching side with residents, doing clinical research. I think those opportunities are much easier to do in an academic setting where you have the infrastructure, like for IRBs and such, and to collaborate with other colleagues. I am, though, randomly a couple residents, fellows started rotating with me at the surgery center when they found that I was a new surgeon there. And now I'm adjunct faculty at Temple for 2 departments, which is really cool. So I have like a volunteer faculty role, which has been nice. And then other things. So with academics too, you might see more interesting cases. You might be able to get surgeries sooner, more under your belt because you already have an established referral base. Where there's me, like I'm brand new, especially now kind of starting over, especially on my own. I'm hanging like, my new door sign and such. And now I have to really rely on myself for marketing, right? No one's just going to walk through the door unless they see some, like whether it's a Google ad or something out there about me, or another patient refers them to me. It's not like you just like for, especially in private practice and for cosmetics, you really have to hustle in terms of marketing and recruiting patients. Let's see what else kind of pluses for academics. Also in academics, you definitely have the support and opportunity to do more reconstructive cases. So I do miss that side of being able to do reconstruction. For me, again, as someone who doesn't take insurance, I'm not appealing to other providers. And so at the same time though, in the real world perspective, when you start to see, like my first practice, what you're actually reimbursed and such, again, I don't want to use it as a reason for not treating patients with for insurance purposes, but you see how much that the insurance allows and you get paid, that sometimes it's a it's a negative aspect, where then a lot of patients who aren't, or a lot of surgeons who are in facial plastics, end up going cash only, no insurance regardless, because from a financial standpoint and income standpoint, it makes more sense to do that. Now on the also in academics, or if you're in a larger hospital system, you don't have to worry about the marketing and business such. You have, medical assistants that work for you. You don't have to worry about hiring or firing. Any job, it's the most specialties in medicine, it's really hard to just treat it like a 9-to-5 job. I'm just going to be honest about that. So just take that in consideration. Even if you have a family and such, you're always going to have to prioritize your patients first. The only like specialties where I think that you could really like leave your work at work and then separate it from home, I would say emergency medicine, and being a hospitalist, because those are really shift work and someone actually takes over your patients, and it's mainly like in an acute or inpatient setting. So in a way, if you're in academics or a bigger hospital system, you don't have to worry about hiring and firing your employees. All the anesthesiology, that's a good one too, but you have to take call. So I think if you're more outpatient and you don't have to take call, then I think that one's another, go into anesthesiologists when they take call. I think even in private practice, a lot of them I think are in-house. They don't necessarily take home call, because if there's an emergent airway, that's like a matter of life or death. So good question. So let's see here. And then, you compare it to, say, in private practice. So for me, as someone in private practice on my own, compared to someone academic. So for taking call, I only take call for my practice. So that means, yes, I don't have someone covering for me like I would in a bigger group. In case of a patient issue and I'm out of town, I usually have to find someone to help me out. But otherwise, my patients are usually healthy, they're not sick. So it's very infrequent that I, need to call patients back or see someone on the weekend. And I don't take ER call or hospital call. So, really for the most part, weekends are mine. I also, because I'm cosmetic based, not insurance based, all my patients, pretty much if I do surgery, they go home the same day. I'm not doing consult or taking call. I don't see patients in the hospital. So in terms of my hours, it's mostly around just me being in the clinic, kind of 8 to 5. I don't have to go to the hospital around on patients before or after or go see consults or anything. And when I'm in the operating room starting at 7:30, I'm there, whatever, 6:30 to 7, I'm there through the last case, whether it's, 1, 2, 3, 4 o'clock, and that's it, pretty much for the rest of the day. So I don't have to worry about going to another facility. My time is more protected in that way. Also, when you are your own boss, you have more autonomy in terms of how much you can make, more control over it, because you are really directly, paying your overhead and your employees and such, and more goes to you instead of you just taking a percentage. You also have control over your hours. So just know, then that incentivizes you to be able to make more in private practice, but also it means if I go on vacation, not only I don't make money, but I lose money because I have to pay things like for rent, for my staff to be there to cover the phone, to, have things working and ongoing while I'm out of the office. I have control over my practice in terms of the patients I want to see, my branding. At the same time, though, then I have to worry about that, like, paying for my marketing, hiring, firing my employees and managing it. So there's like a plus and minus, in each way. But I do think kind of from a work-life balance of, seeing, mostly healthy patients, seeing patients that are cash only, those are some pluses there that help with the work-life balance from that standpoint. And so otherwise, the other thing I was going to mention, I might have mentioned this last time. So I'm now a mom of a 17-month-old son. So he's now a year later. So I'm also happy to, help answer questions related to work-life balance, being a surgeon, a mom, and especially too, like the challenges or obstacles that women face in medicine or particularly surgery. So what I'm gonna do is I'm gonna show one case here, gonna walk you all through it. At some point, I may just ask and see if anyone has any guesses on what this patient has had done, and then give a couple of minutes for any opportunities for responses, and then I'll go from there. So I'm gonna go ahead and share my screen. Perfect. Okay, so can you all see this patient here? Okay, perfect. So this is a really lovely patient of mine. I've gotten to know her really well. She ended up being both a cosmetic and reconstructive case in a small time period. So the left image is her before picture and the right image is her after picture. I would say she's had some filler too, but can anyone guess what one surgery that she had done for, to help make herself look more youthful? Okay, so someone guessed Botox, lip filler. Okay, how about something facelift? Okay, any other surgery guesses? Nose job? Rhinoplasty? Okay, good. Thanks for the guesses here. So my philosophy when it comes to before and afters is like, I like to help patients, create beautiful natural results, but also conservative too. So when someone walks in my office, this is the spiel I give them. They look good, feel good, but as if no one knows what we exactly did together. So I would like to think hopefully you see a change, that she looks better on the right, but you can't exactly tell what was done. That is like perfect. I'd rather as a surgeon that when a patient comes back, they're all well healed and their family and friends say, oh, like you look great. Did you color your hair? Did you go on vacation? We just can't tell, but we just tell because once someone can obviously tell, sometimes too, if it's your significant other and they just know you that well, is one thing, but that means that it's such a noticeable difference that it's a bit, incongruent, that maybe it's like too much, if it makes sense. So she actually had upper eyelid surgery. So if you can look at her eyes here on the right, you see that some of that heaviness is taken off. This is a surgery that can be done in the office under local anesthesia. They have stitches in for a week. good amount of bruising for like 1 to 2 weeks, like I, punched in the eyes. And then this is probably her 6-month result, after all the swelling and such was gone. And they look pretty good about a month out. And then you just give it more time to let the scars fade over time. The scars themselves are usually within the crease of the eyelids. I'll show you here, a little, let me see if I can show with the scars. So you can really see, you can see on the left here where the redundant tissue is too, and on the right, 6 months later, those scars are really faint, but they're within the eyelid crease. So when I saw her 1 week out, she was doing great. And then 2 days later, it was a Sunday night, I was super pregnant. She texted me that she was in the ER waiting to see a plastic surgeon on call because her dog had accidentally jumped up and, bit her around the left eyelid area. So I, decided, to see her that night because she was my patient, even if I wasn't on call, just to help take care of course, she had a recent surgery with me. So you can see here on the right, this is the night of her trauma where she had multiple lacerations, some on the nose, the corner of the, or right by, the left medial corner of the eyelid, and then also along the upper eyelid. Luckily for her, it looks worse than it is in the left upper eyelid. It's just that incision just opened up. She didn't have tissue avulsed. That would have been a very different situation where you had to think about, okay, do we need a skin graft or something else to replace the tissue? So you ideally want to repair traumatic injuries within 4 to 6 hours of the injury, just from an infection standpoint, healing standpoint. So I clean things out and repair things as best as possible. Let's see here. Let me show you this. This is after her original surgery. Just so you can see, this is before her trauma. The typical the stitches and such, and the bruising at 1 week out. And this is after the trauma with the repair, maybe at 2 weeks out before I took out the stitches. So you can see there with the stitches. And then a couple of things that I, let's see here, noticed in her healing process, and it just with a matter of time, luckily they, resolved on their own. So this is probably about a month out. So a couple of things I noticed, and I was anxious about it. Luckily, in medicine, you have colleagues, so it's always good to consult colleagues and ask for help. That's sometimes the hardest thing to do, but just to make sure, did I need to be more aggressive in my, management, or is it okay to do a waiting game? So for her, the couple issues I noticed, there's appointments. So you can see her left eye here, the aperture, like the amount of show of the blue portion of her eye is less compared to the left image. So she was basically showing ptosis. This is a condition that some patients have when they complain about heaviness of their upper eyelids. It's something that I am not formally trained in to repair. So when you do an upper eyelid consult for aging eyelids, not only, I'm looking at the redundant tissue, but if they have ptosis. If they have ptosis too, I would say it's best for them to see an oculoplastics surgeon who does that repair all the time. So I saw this ptosis. I went back and looked at her images, especially right after surgery before her trauma, and noticed she didn't have ptosis then. So the good thing is I didn't cause this. And it's likely, as my colleague, explained, probably from the swelling of the eyelid from the trauma. And, I'll show you again her final after picture 6 months out, but it luckily resolved on its own. Then right here in the medial aspect here, by her eye, she also developed webbing. This is a concave area, and just in certain areas, depending on the contour, they can develop webbing if it's just the position of the scar. Webbing meaning like a thickened scar there. So it's something where we just watched, and luckily with a little steroid cream and with time that it flattened out, which is really nice for her. So if you go back and you look to her then eventual 6 months out, it's great. You could never obviously tell that she had trauma. The face heals really well. Her ptosis resolved, and again, this webbing here has become very minimal, and we didn't have to do any surgery or anything else to intervene, just medical management. She is someone who then eventually because she was happy with her eyelid surgery results, wanted to do more surgery with me. And then hopefully you didn't see that category there. If not, so let's see, and for time's sake, we can just discuss it instead of so she ended up getting a facelift and neck lift with me as well. So this is her about 6 months out. So you can usually, like, on the lateral or oblique views, you can see more of a change, especially the neck, but you can see on the front view how she just has more facial definition, you know, compared to the left side. Let's see here. This is on her left side. So when we do a facelift, the incisions, you know, start kind of in the hairline. They end up go like along the ear cartilage behind it, around the lobe of the ear, and then behind the ear into the hairline. So they're very well concealed. And you can see, like, you know, she's someone too who, you know, works out a lot. She just kind of, genetics was not in her favor. As we age, we lose volume, gravity pulls things down. So we have more skin laxity of deeper tissues, but now she's got a nice jawline and neckline here that, and it's like the neck she never had, you know, besides the aging changes. I'm just going to go through and then show other. So again, from the left to the right, hopefully you're seeing a difference here. But again, let's see here. And that's her right side as well. So okay, so I wanted to give the opportunity for like the last 20 minutes for any questions. So thank you so much for listening to me. Hope you learned a little bit about, you know, my profession and facial plastic surgery. I would love to help answer any questions at this time.
What's the most common surgery that you've performed on patients?
Most common surgery, that's a good question. So I would say right now, I do a good amount of eyelid surgery, like say upper or lower eyelid surgery. I think you know, we like to say that eyes show the first signs of aging. So a lot of times if we rejuvenate this area first, the cheeks, it goes a long way to rejuvenate the rest of the face. In younger patients, I do a good amount of liposuction to help with that jawline contouring. And then also buccal fat removal has been a very popular procedure. It's basically, if it's on the right patient, like someone who complains that they have really round face, chubby cheeks, it's a procedure I can do in the office, like a dental procedure, where the worst part is numbing with the local anesthesia on the inside of the mouth. And it's for patients where if they wish their face was a little more contoured, if you did this motion like this and wish like right here, there was a little less volume, we take out a walnut size amount of fat on each side, and it helps create more contour there on patients with fuller faces. Okay, so I have a question here. What challenges did you encounter during your fellowship? So fellowship, I feel like is the time where you can really focus on your craft, like to really make the most out of what you're eventually going to do. So it was a great year. Also too, sometimes you get less, depending on the fellowship you train in, sometimes it's less stressful compared to residency because you only have the responsibilities and the focus on that subset of your original residency specialty, and you're more, you know, eager for it, you're more interested because that's what you want to, you know, specialize in ultimately. I think the one big challenge for me is when it came to applying for jobs. You know, I had thought in my mind, okay, like I've done this specialized training, you know, it's a competitive specialty, and then, you know, I've sought out more time investment to be a, you know, to specialize more, that there's going to be jobs out there. But you know, but unfortunately for facial plastic surgery, there isn't. Maybe partially because it's a smaller subspecialty that it had to, you know, establish its own position You know, I know historically there's been battles that my, you know, mentors or those much more senior above me to establish facial plastic surgery as a, you know, a recognized subspecialty. Because when you have like plastic surgeons who've been there and who do some of these procedures like rhinoplasty and facelift, and they look at us, we're newer, you know, especially and say, you know, what kind of training or credibility do you have? That they had to fight for that, for us to have our own academy and such. And so, you know, ultimately, especially going into cosmetic surgery, it's, you know, a lot, what was I going to say? A lot harder per se, that there's not just necessarily a job out there. So I had to basically cold email around in the geographic areas I was most interested in. And the first job I got was like, you know, it wasn't like an advertised job out there, but it was, you know, they were thinking of bringing on a plastic surgeon. So it was then, you know, me helping to put the idea more in their head, and that we then, you know, created an opportunity together. It wasn't a formal opportunity out there. And then too, like just learning, because now, you know, I'm on my own. I went through, you know, working for 2 other practices. You see ups and downs of, you know, what wasn't ideal or perfect. If I could go back and do it all over again, I would have had hoped for another opportunity where I could have been more surgically active in the beginning. So I would, you know, be able to get more confidence, experience, not feel rusty early on. Because when you're in private practice, a lot of it is just learning on your own. You know, whether it's managing patients and complications, it's a big deal. So, are there any surgical procedures you prefer not to do? That's a good question. So I really appreciate my ENT training. I think I would have been fairly happy being a general ENT surgeon as well. I'm, you know, just now further removed that I just don't, even if it's been, you know, 3 years or so, like not comfortable to do those ENT procedures. So just because I feel like you know, you don't want to feel rusty. You want to feel like very in tune with the anatomy and the technique. So I would say if I stayed at general ENT, the niches of ENT that I didn't enjoy as much or didn't feel like I was as good at, one was sinus surgery. It's like endoscopic. You have a video monitor. I just feel like it's less tangible. I feel like my co-residents who were really good at video games had an edge over me. I just was never great at sinus surgery. And then also ear surgery or otology was not my forte either. A lot of the surgeries are done under a microscope. So again, it's a very different kind of approach to surgery and feel than what I do currently. In terms of facial plastic surgery, surgeries I prefer not to do. That's sorry. I think the only thing that didn't interest me, you know, that I've not actually sought out is hair transplantation. It's just not something I saw it, interviewed for fellowship, and I felt like that was enough for me. Which sector of plastic surgery do you prefer, and why, the cosmetic or the reconstructive side? I actually enjoy both. I do. If I could, if taking insurance was not an issue, if I had the right practice set up, you know, like if I didn't have to worry about what this paid versus that in terms of hours you put behind it, I would love to be able to do both cosmetics and reconstructive. I think, you know, there are days where I question, okay, this high maintenance cosmetic patient, you know, is making me have a challenging day. You know, there's just a difference for when you help a reconstructive patient, the sense of gratification and results you get. It's just different. What was something you learned during residency and fellowship that has stayed with you until today? That's a good question. Being appreciative of the mentors and support you have and to pay it forward. I think I am lucky that I had, even starting in high school, like some strong female mentors in surgery, you know, who I could ask for advice, look up to, and to have female mentors as residents and like the presence of them, you know, in my department. It wasn't just predominantly male, I think makes a difference too in your training. You know, my fellowship mentors have been male, but even if the one, you know, he's a renowned rhinoplasty surgeon, I had a much more formal relationship with him. Like both my mentors, they are those who I could text or call or send an email to ask for advice for cases. And I do that actually when I've had difficulty with patients. And I think that's a big deal, to have that support system, because again, as I mentioned earlier, the hardest thing to do often is to ask for help. You're going to make mistakes, you're going to learn, especially when you start out in practice. And I think so too, ultimately I'm where I am because of the advice, the support I've gotten, and I'm really grateful for that. And, hopefully I would like to be in a similar position for others, especially other future women in medicine, to help in any way I can. I think it's important to, realize too, the opportunities you have, the luck that you have moving forward, because a lot of it is due to, where you come from, your background, and the opportunities associated with that. It's more common for cosmetic plastic surgeons to start their own private practice, but can reconstructive plastic surgeons do the same? So I would say yes, but it's very different. If you relied totally on just reconstructive insurance base, you may see that for what you're doing, you don't make that much money. But of course, like you have, for instance, general surgeons, right? They are those in private practice. I'm not sure, you'd have to ask someone, hopefully if you have a general surgeon speaker, if it's common for someone by themselves, like one surgeon, to be on their own and have their own office and such. It might be more practical for them to be in a group of surgeons. So for instance, because that they have more surgeons around to take call and share the call, because their patients can have, issues after hours. And two, to take on, if you have, it depends from an overhead standpoint. Sometimes it can help from overhead. Say you have one schedule that covers multiple people, or one biller that covers multiple surgeons, but then you need more staff and maybe a bigger office to cover multiple surgeons. But then different than one surgeon, like, for me, I have to hire a minimum amount of people. And so that covers, just me, but they could cover potentially two surgeons. There are, cosmetic or plastic surgeons out there who do both cosmetic and reconstructive. I think that's the more common, and just how much they decide to do it. Like if I had always continued to take insurance and then it was an easy transition, I would still do it. But it's very hard right now to get in with insurance and to figure that out. And then you have to deal with billing and such, that it just, at the end of the day, and talking to other colleagues, that they just, got out of it, or it just doesn't seem as opportune to get back into it when I have been cash only for some time. What do you see in the future of your career or specialty? Any plans? So I'm hoping to, like right now, try and just focus on me, stay small, develop a boutique practice. This is the first time where like I get to have the most say and control over my brand, what I do, even if I have to, deal with other things outside of my clinical hours, like managing employees, like this past weekend payroll and such. I do appreciate, it's just refreshing to have my own autonomy, be my own boss and really call the shots. I'm hoping to, hopefully build that. It's going to take some time and to, be able to have a presence in my community as a, as a good practice, as a niche practice. In the future of our specialty, I think there's going to be avenues of, in terms of non-surgical, minimally invasive, that other surgeons or devices or companies are going to try to push. So for me, I'm more traditional. I learned of, hey, like I like to offer patients a definitive, surgery, it's rhinoplasty or facelift or neck lift. I think there's going to be, evolving technologies to see if those surgeries can take less time or be less invasive. Maybe they don't have as dramatic results, but a lot of patients nowadays are worried about surgery or don't want to have surgery. Would you ever
Dr. Ho, sorry. We're kind of cutting a little on time, but
Okay.
I have one last question that I usually ask at
Okay.
the end. All of our audiences are either in high school or either early college. So I guess the question that I would ask you is, what would you recommend, or for people that know, the youth that know that they're interested in medicine, what would you recommend that they do, or is anything like that, if you have any advice to us to give to us?
like in terms of getting into med school or just in general, like advice?
Like just about the medical field in general, like besides medical school, you know, being more invested in medicine, how to start from like an early age, because a lot of people in high school don't know yet that they want to be in medical school or want to go until college, if that makes sense.
Right. So I would say, so what you want to do is first figure out if you want to do medicine or not. And it can, you can make that decision after college too. So don't feel like you have to, like this whole process, you don't rush. Even when I was in medical school, the increasing trend was for med students who are starting grad school that they're older on average. So I think increasingly people are taking gap years, and I think med schools want to see students who are focused and mature about it. I would say my colleagues who are older than me were probably better students than I was because they were focused, you know, they're out in the real world. Maybe they themselves really had to take on, you know, their med school loans. They're very serious about it. And I think there's a maturity there that is, you know, to be said. So really take the time. I know this is a weird time with the pandemic, but do what you can, whether if you shadow these virtual meetings, try to shadow someone, even if it's your previous pediatrician, so that you can get an exposure. Like, you know, you don't have to decide today if you want to be a plastic surgeon or not. It's more, do you, you know, enjoy medicine? Do you want to interact with patients? Do you like science and math? Because if there's some other career profession, whether it's being a lawyer or going into business that you are just as interested, I would say strongly consider it. You know, it's medicine is kind of all or nothing when you're in it. And you know, you don't want to go into it for like the prestige, for the salary, anything like that, because it's not worth it ultimately. And then otherwise, like, I would like to think my journey is an example of, you know, hard work pays off. So just keep the focus, you know, work hard, develop a good study habits. I lost some of that in college. I was able to cram, you know, before tests. And I feel like that, you know, then once you get to that tier of really excelling students in med school, you know, you really need to have good study strategies and like work ethic then, and in residency too, when you're studying for exams and eventually the boards. And if you have that focus and work hard, then just make sure to along the way to take the opportunities to stay balanced, whether it's taking time off, making sure you pursue those other extracurriculars outside of medicine you enjoy, getting that strong support system, because it's such a it's a worthwhile journey. You know, I love my job. I could put in any hours. My husband, you know, calls me a workaholic, you know, but I love what I do. And I think that matters at the end of the day, you know? And so but make sure too, like, you know, if you look at my Instagram, we love to eat, love to cook, go to restaurants. I have a son, you know, so I try to make time for him when I can. We like to travel. We like live music concerts, you know, in normal life. So it's good to have that, because that will make you the most, you know, well-rounded or fulfilled person and doctor ultimately too.
Okay, sounds good. We're gonna end it here, but thank you guys so much for coming on. This Zoom call is being recorded, so we hope that this will probably go up in the next day or two. So if you miss anything or anything important, or you want to just go over some stuff, you guys can look back at the recording and we'll link it on our Google Classroom. And Dr. Ho left all of her Instagram and stuff like that. So if you guys have any questions, just you know, email her or, you know, DM her. But I just want to say we thank you so much for coming on for us. This was definitely really insightful, and I'm sure a lot of us learned more about plastic surgery and just about being a medical professional in general. And yeah, thank you so much, and make sure you guys say thanks to Dr. Ho.
Thanks so much. Yeah, thanks for having me again. I appreciate it. And feel free, definitely would love the following support on Instagram, and happy to answer any questions. Don't hesitate to contact me at any time. So, okay, take care. Have a great week. Yep.
Yep, you too. Bye. Bye, everyone.